Dr. Ashwani, of late autoimmune conditions growing rampantly, and people think that one autoimmune condition is different from the other because it impacts the different part of the body. So can you briefly explain what is autoimmune condition?
Right. So autoimmunity is a dysfunction of the immune system. Immune system has gone haywire. Okay. Immune system, which was supposed to protect us, started doing a damage to our own self. Now, depending on which organ comes under the brunt, for example, if thyroid is under the attack, we call it Hashimoto thyroiditis. If joints are under the attack, we can call it as rheumatoid arthritis. If your skin is under attack, we can call it psoriasis. And if skin and joints are under the attack, we can call it a psoriatic arthritis, right? So essentially it's an immune system problem, eventually leading to damage to some part of the body. IBD, inflammatory bowel disease, again, intestines are under the attack, right? So if we have to understand the disease better, we have to understand why this immune system is being dysregulated. What are the triggering factors? Most of the time it is told to us and generally believed it is a genetic disorder. But it doesn't happen at birth. Most of the time it happens late in the life. For example, somebody is 30 years old and some autoimmunity starts in the body. Somebody is 50 years and starts psoriasis, right? So it doesn't happen at the birth. So we cannot purely call it as a genetic problem. Yes, there could be a genetic predisposition, but along with the genetics, there's always a huge epigenetic factor. And this is what we have to understand. What are those epigenetic factors which is triggering this autoimmune disease in the body? And by understanding and removing or altering this epigenetics, we should be able to fix the autoimmunity of the body also. When we treat various different autoimmune problems into our practice, we have seen set triggers behind it. The first step is kind of diet. If somebody is eating inflammatory diet, for example, a lot of gluten, lot of milk products, lot of sugars, lot of processed foods, these are all inflammatory foods. Now, as inflammation will go up, autoimmunity can go up. So if you reduce the inflammatory foods, your immune system will calm down and the severity of the problem will come down. Second very important thing behind autoimmunity is a condition called leaky gut. Now, leaky gut is a situation where your intestines have become more leaky, more permeable. Ideally, job of the intestines of the digestive system is to break down the food, digest the food, take the nutrition in and throw away the waste. Now, when along with the nutrition, some toxicity from the intestine is going into the blood, some undigested food from the intestine is going into the blood, this is triggering a huge immune response. So anybody with the autoimmune problem, they will have typically some digestive issues also. So second trigger is a poor digestive health or a condition called leaky gut. And if we address this leaky gut, then also you will see there's a huge relief happening to the patient. And one of the reasons behind leaky gut is a chronic infection, simmering infection in the intestines. So as we address this infection, leaky gut becomes better, inflammation gets better, autoimmunity in the body gets better. Another very, very important reason that we always see is some level of toxicity in the body. For example, some aluminium, some lead, some mercury. These are some foreign bodies deposited into tissues. Probably immune system is reacting to it. As immune system is reacting to it, autoantibodies are increasing. So if we address these heavy metals from the body, we start chelating these heavy metals from the body, we always see that autoantibodies are also coming down. Inflammation is coming down and autoimmunity is settling in. Another very, very important, crucially important part of autoimmunity is people who don't get enough sleep or they're nutritionally deficit. They are running on old faulty cells. They are not replacing the old cells with the new cells as it should happen. And immune system want to get rid of these old cells. So if you improve your lifestyle, you sleep at the right time, you repair your body with proper nutrition, your immune system will calm down and severity of the autoimmunity will come down. And you can stay away from the disease also. So it's a work on the lifestyle, work on the food, work on the leaky gut, work on heavy metals, work on repair. Through right kind of nutrition and food, you can stay away from the problem. And if you get a problem, you can get out of the problem also. These problems are not for life. If a problem can come to human system, we can make it go away also, as long as we do the right things for it.
Conventionally, people say that if it's a rheumatoid arthritis, I'll go to a rheumatologist or a joint specialist. If it's a psoriasis, I'll go to a skin specialist. If it's autoimmune disorder of, say, type 1 diabetes, I'll go to a diabetologist. So are you saying that the way we should be looking at autoimmune disease is not by the name and the organ, but by what is the 5 or 6 triggers that you have identified, which is then causing the specific organ to get damaged?
Absolutely. So if it is type 1 diabetes, we will certainly need an endocrinologist to help us with insulin, because autoimmunity has done a damage to the organ, which is the pancreas, and this organ is no more functioning. So we need a doctor or endocrinologist to help us with insulins. But if it is a psoriasis, if it is a arthritis, or it is Hashimoto's, right? It's an immune system problem. And typically, most of the cases, not a permanent damage to the joints or to the skin or to the thyroid gland. And if we remove the triggers, you don't have to go to multiple doctors for it. You can go to a right functional medicine doctor or a practitioner. They will help you eliminate these triggers from your body, and you can calm the system down, and your skin will clear, your thyroid will get better, your TSH will come down, your joint pains will get better, just consequently. So again, I'm saying we are not treating arthritis, we are not treating psoriasis, we are not treating Hashimoto's. We're just making your body healthier by removing these root causes from your body.
Once the patient gets okay under your treatment, what should they continue for life so that these things don't come back again?
Right, just like a car, you buy a new car. Okay, you run it for some time, you take it for service, which means you change the fuel, you change the engine oil, and if any unwanted things are there in the car, you want to remove that. That's all. Same with the human system. Okay, you keep the good lifestyle, which is you sleep at the right time, get enough sunlight, get up in the right time, and don't expose to too much of artificial lights. Okay, get the right food in. Very, very important. Our body, our cells, everything is made of the food that we eat. So if you put in right things, your system will perform better. Okay, make sure your microbiome is healthy. Make sure your body is getting enough nutrition. Keep testing for it. Every 6 months, every year, you can test your nutrition, you can test your inflammation, you can test your liver function. And if anything is going haywire, you start optimizing it. So as long as you maintain your health, disease will not come. Disease only comes when you stop maintaining, and dysfunction has become so much, then it turns into a big problem.
And can you elaborate on a concise form of patient that you would have seen in an autoimmune condition, and how did he or she get completely reversed?
Right. So just a case of psoriasis. Okay, psoriasis is pretty much easy for us. I think we have seen a lot of psoriasis reversal so far. So there was a case, almost every part of the body, the skin was inflamed, badly inflamed and scaling badly. And first 2 months, we could not see results also because the severity was so much. And interestingly, a person was put on a lot of steroids before they came to us. Now, steroids are immune suppressants. Temporarily, they give the relief to the body, but when immune system is suppressed, it will grow more fungal infections. And one of the things that we always see in psoriasis is a fungal infection. Now, when somebody is on the steroids for a long term, their infections would grow. Right? They temporarily feel okay, but infections are growing. So that has made the journey for the person much, much more tougher. So slowly, as we reduce the fungal infections, as we reduce the inflammation, we start putting off the steroids, right? And this person took 6 months. And in 6 months, the person is clean. There's no more psoriasis on the body.